Hello, this is Edward Lambert with another video of 6-element theory for acupuncture. And this video is going to be about the bladder meridian supporting the liver meridian. And it's another meridian relationship in the embrace of the foot yang and foot yin triangles. Both these meridians enjoy the freedom to move about. Liver is the integration of body movements so that different parts of the body move to one purpose. It's like for the hand to function, the fingers and the wrist and the muscles in the forearm all have to coordinate for this one movement. So you have these individual muscles and parts of the hand, wrist, and forearm creating one hand movement for one purpose. The liver is the integration for these movements. In order to have this type of integration, the nervous system must connect all parts of the body. When the nervous system runs smooth, the body is coordinated, agile, responsive, and quick. A healthy nervous system is very important for supporting the calmness that the liver requires for coordinated expression. Both liver and bladder meridians traverse the top of the head and integrate brain function. The brain consumes a lot of blood compared to the rest of the body. Even though the brain is about 2% of body weight, it will consume around 20% of the oxygen in the blood at rest. Still, the nervous system itself supports the potential energy in the liver's blood by integrating body functions. Liver blood deficiency is many times indicated by symptoms of weakness in the nervous system. These symptoms include numbness in the body, tremors, tics, dizziness, and muscle spasms and cramps. The blood is deficient, as the tongue is pale and thin. The pulse can be thready or thin superficially. These symptoms show that underlying the liver blood deficiency is an exhaustion of the bladder's nervous system. Eventually, the circulation of the blood will weaken. Thus, we see that nervous exhaustion takes its toll on the liver blood. The nervous system is a foundation for blood circulation and invigoration. Sexual activity, especially orgasms, requires the liver to expend a lot of energy. The nervous system of the bladder supports the sexual expression of liver. When sexual activity is excessive, there is a drain on the bladder's nervous system, which can lead to nervous exhaustion. The kidney meridian also supports liver sexual expression and can be depleted by excessive sexual activity. When the water element is depleted, some conditions which result are nervous exhaustion, restlessness, dry mouth, weak legs, and faint feeling. In such cases, the body needs to be rested so that the water element can regenerate. Here are some point combinations between the bladder meridian and the liver meridian. Bladder 63 and liver 6 for urinary discomfort related to the liver meridian. Bladder 39 or bladder 40 and liver 1 for involuntary erection with difficult urination due to excess in bladder meridian and obstructed blood flow in lower burner. Bladder 1 and liver 2 for night blindness due to heat in the blood. The blood doesn't cool down enough to see low light levels. Bladder 10 and liver 2 for inability of legs to support the body due to weak bladder meridian not circulating creative energy. Bladder 52, bladder 64, and liver 3 for pain in the genitals due to excessive sexual activity with nervous exhaustion. Bladder 44 and liver 4 for esophageal constriction due to nervousness, which constrains free flow of blood through chest. Bladder 67, liver 8, and ren 3 for seminal emission due to nervous weakness not supporting sexual function, maybe due to excessive sexual activity. Bladder 11 and liver 8 for wind painful obstruction syndromes where blood and nerve stimulation is not circulating freely. Bladder 32 and liver 13 for rigidity of lumbar spine with inability to twist due to lack of free movement and flexibility. Treats constraint of waist from liver stagnation.